Hello everybody, and I hope this finds you well. Thank you for taking the time to tune into this weekly video. I'm Heather Knox, Chief Executive here in NHS Lanarkshire. I want to talk to you today about the new Omicron variant and how that is progressing through Lanarkshire at the moment. So I'll share with you the numbers, and I'll also talk a bit about our chair, who has just had her last main board meeting. And we've said goodbye to her this week, which is sad, but we'll talk about that. And I'll also talk a bit about the support we've had from the military over recent weeks, because that's been absolutely fantastic. So if I start with the numbers, first of all, yesterday's numbers we think are slightly underreported, but they are showing 642 new cases within Lanarkshire. It's been as high as 900 the previous day, and we are seeing those numbers increasing in general. So yesterday's numbers we think were under-recorded, and we're now seeing a lot of those cases being reported as Omicron. We think that we will soon be seeing Omicron being the dominant variant and taking over from Delta. In terms of patients in hospital, that is still going in the right direction. We've got 51 patients with COVID across the 3 hospitals at the moment, and 3 patients in ICU, and 4 care home outbreaks. Our booster programme's progressing really well. We've got 284,000 people now received the booster within NHS Lanarkshire. And again, if you can reinforce the message for people to book in for their booster, those slots are available and people can book through NHS Inform pretty easily to get that done. It's really important, particularly in advance of Christmas, to get that done. The modelling numbers around Omicron are of concern. However, we need to see how Omicron actually takes effect in terms of hospitalisations, and we won't really know that until the week before Christmas. So it's a bit of a waiting game at the moment, but we do know that that will become the dominant variant very, very quickly. And we are asking staff to be really careful in terms of the number of people that they interact with out with work, and to stick with the guidance that's been issued by the First Minister, so to limit social contacts to 3 households wherever possible. And that's really just to make sure that the spread can be minimised and we can all stay as safe as we can in the run-up to Christmas. I'm going to say a bit about our chair, Neena Mahal. Neena Mahal has actually been on the board for, I think, about 17 years, over 17 years in total, and obviously a lot of that time as the chair. And we said goodbye to her formally after the board meeting this week. So a bit sad, because she's been a fantastic chair and I've learned a huge amount from her. And as you know, her chairmanship was extended. She originally should have gone some months back. So we've had the benefit of having her a bit longer. And I hope within the next few weeks to be able to confirm who our new chair is, to let you all know that, but I haven't got confirmation of that quite yet. The final thing I wanted just to cover today is just to say a huge thank you to our military colleagues who supported us across the 3 acute sites and are continuing to support us at the moment in our vaccination delivery. So I just wanted to say thank you. They are leaving us, I think today's their last day, so they're leaving us for a well-earned rest and a Christmas break. They may be back with us in the new year. We haven't confirmation of that yet, but I'm keeping my fingers crossed that that will be approved and we will see some of them back on the wards and in our units again and helping us with our vaccination. So I'll end there today. Thank you very much for taking the time to listen to me.